Hi, my name is Stephen Jarrett. I'm working with Yaku Akamoto. We will be doing the Dr. Mitch Cordova Joint Mobilization Implementation Badge. The first step is to apply grades 1 through 4 joint mobilizations to tibiofemoral joint in an anterior-posterior glide. So say if Yaku were lacking full flexion of the knee, anterior to posterior would definitely assist in that motion, and then we will describe what the relative amounts of force and motion are, and then go ahead and do the same to the second metacarpal joint. So first off, let's start with the tibiofemoral joint. Have them completely relaxed. Good, good. Now, if I wanted to, I can use my legs, pull down and distract the knee, and start to mob. So like I said, if he's lacking full flexion, ability to go back, the tibia is rolling forward anteriorly when you're going into flexion. So using this anterior to posterior mode will definitely help him with his flexion. Okay. So I'll distract the knee anteriorly. With the knee relatively decent amount of force here, in order to translate, and then posterior glide, and anterior again, and posterior glide. Okay, now to be specific in what grades I'm using, grade 1 for anterior to posterior, I would start at the beginning range, so find that point where it just starts to translate, and mold there. Maybe you want to oscillate at that point, and good. Go back to posterior. And then grade 2 would also be beginning to middle range, and you'd also oscillate. So anterior to posterior, anterior. You oscillate that. Usually grades 1 and 2 are for pain phase of a rehabilitation. And then grades 3 and 4 are more for range of motion, but also they may incorporate pain. Just getting everything in the joint to wake up and realize what's going on, getting moving again. Grade 3 for anterior to posterior glides. Anterior to posterior grade 3 is middle range. And oscillate. Yeah, very lax joints here, very mobile knees. Like I can feel the translation. And then grade 4 joint mobilizations are usually middle to end range, and you oscillate at the back of that end range. So anterior, oscillate as far forward as this tibia will translate. And then posteriorly, oscillate at the end of that range. Back anteriorly, oscillate, posteriorly, oscillate. Next thing we'll do is for the second metacarpal joint. I see your finger. Now, fingers are have much more dexterity to them than a knee, which is for motion and also some support. Start off with, for glides of this, say if he were lacking extension of his finger, I would go, I'm trying to think of the word for this. Joint is relatively easy to glide. Grade 1, I go to the beginning of his motion and just oscillate. Once again, if it was pain present, this will be what we were trying to treat. Grade 2, I'd go begin in the middle range. Once again, nice laxity in the joint. Start to feel resistance in this MCP joint, actually towards the end of the range, not actually during the range. Grade 3, I'd go middle of the range. Grade 3, once again, is for more range of motion. Go to the middle of the range and just oscillate. Then grade 4, I'd go middle to end. And just oscillate at that end range. Good, good. For the second phase of this, we applied grades 1, 2, and 3, 4 to the glenohumeral joint. Feel where the resistance begins. Does it get greater as you move the humerus through the glenoid fossa, or does it stay relatively the same resistance throughout mobilization? Joule does the amount of mobility for each of the grades compared with those. Okay. Well, let's go ahead and hit grade 1 for the glenohumeral. Say if Hiku here, we got convex on concave. If Hiku were lacking, if Hiku were lacking full flexion, so if he were lacking to get up to, if he were lacking to get up to about, if his end range was only here, so it's at about 90 degrees of flexion, I'd take him to his end as far as he could, and then I would push superior to inferior. So ideally, I'll have Hiku sitting down that way gravity's not weighing down on his arm as well. Or even I'd have him laying down, but for the sake of the camera angle. So like we said, push inferior, superior. Good, good. So grade 1 is beginning range. I'd oscillate at that beginning, pushing then grade 2 range is begin in the middle. And oscillate. Grade 3. And then grade 4 is at the end of his range. Oscillating in the back of that capsule. And the question was asked, does resistance get greater as you move the humerus through the glenoid fossa, or does it stay relatively the same throughout the mobilization? Let's check. So like I said, say if his only motion were here, I'd say the higher in the flexion I go, the more I start to feel resistance. Yeah, and the more I'm down by his side, the less resistance that is. I would say possibly muscle tonus when you get up into this full flexion is preventing it. Okay, good. And as far as which joints were the most mobile, I would definitely say the second MCP was the most mobile. And if you think about the body part that we're dealing with, the finger, whose only function is motion, that would make sense. So that concludes the Dr. Mitch Cordova Joint Mobilization Badge.